Hello, let's discuss anatomy of the face. In the face anatomy, we will be discussing the muscles of facial expression, the blood supply of the face, the lymph drainage and venous drainage of the face, the nerve supply of the face. So, the face has no deep fascia. Why? Because it involves in the facial expression, so it has no deep fascia. The muscles of facial expression is surrounded by the orifices of the face, like the muscle of facial expression are present around the eye. It is present around the nose and around the this oral cavity or mouth opening. Okay, the muscle of facial expressions are supplied by the facial nerve because it is derived from the second pharyngeal arch, and the blood supply of the face is mainly from the external carotid artery branches like facial artery, maxillary artery and superficial temporal artery, while the venous and also some of the contribution is from the internal carotid artery, okay, like ophthalmic artery and its branches, while the venous supply follows the arteries. Okay, and about the nerve supply, so as I have mentioned it before, that the muscle of the facial expression are innervated by the facial nerve, while the sensory supply for the face is by the trigeminal nerve, except the angle of the mouth, okay, which is supplied or innervated by the greater auricular nerve. So first we will have to look at this nerve supply. Okay, so the cutaneous nerve supply is through the trigeminal nerve and its branches. The upper face is supplied by this branch, which is called ophthalmic nerve. Okay, the middle face is supplied by the maxillary nerve of the trigeminal nerve, while the mandibular nerve is supplied by the lower face is supplied by mandibular nerve, except the angle of the jaw, okay, or angle of the face, it is supplied by the greater auricular nerve. Okay, so this is greater auricular nerve, and it is from C2 and C3 cervical spine, ventral rami of the C2 and C3 cervical nerve. Okay, so this is the greater auricular nerve. The branches which gives innervation to the upper face ophthalmic division of the trigeminal nerve, this is the supraorbital nerve, this is supratrochlear nerve, this is infratrochlear nerve, this is the lacrimal nerve, the palpebral branch of the lacrimal nerve, and this is the external nasal branch of interior ethmoidal nerve. Now the maxillary division of the trigeminal nerve, it gives three branches. This is infraorbital nerve, okay, this one is zygomaticofacial, and this one, the third one, is zygomaticotemporal nerve, while the mandibular division of trigeminal nerve gives three branches. They are mental nerve, okay, this is mental nerve, this is buccal nerve, and the third one is auricular temporal nerve. Okay, so these are the cutaneous nerve supply of the face, while the greater auricular nerve supplies the angle of the jaw. Okay, so this is about the cutaneous supply of the face. Now going towards the muscle of the facial expression, so they are derived from the second pharyngeal arch and innervated by the facial nerve. They are grouped as orbital muscles, okay, the oral muscles surrounding the oral orifice or oral opening, and nasal nasal muscles and auricular muscles. Okay, and all of them are supplied by the facial nerve. Okay, now this muscle, big muscle, which surround the orbit. This is called orbicularis oculi, and it helps, or its main action is the uh, closure of the eye. Its orbital part uh, causes the powerful closure of the eye, while the palpebral part, which overlies the eyelid, it causes the light closure of the eye, while the lacrimal part causes the dilation of the lacrimal sac to aspirate the tears from the eyes. This muscle is the frontal baby of the muscle occipitofrontalis muscle. Okay, so this is occipital head, and this is frontal part. This is occipitalis part of the occipitofrontalis muscle, and this is the frontalis part. Okay, frontal part. Now the oral muscle, which surrounds the mouth opening, they are like, this is zygomaticus major, this is zygomaticus minor. This muscle which surround the oral cavity, it is the orbicularis oris muscle. Okay, this muscle is levator nasolabialis. Okay, and this is levator labii superioris. Okay, this muscle is depressor anguli oris. Okay, and this muscle is depressor labii inferioris. Okay, so this is the buccinator muscle. Now the buccinator, we will talk about the buccinator muscle. So the buccinator muscle is related to some structures. We will talk about it. So yes, so this is buccinator muscle, and it is pierced by two structures. One is shown here. This is parotid duct of Stenson duct or parotid duct. Okay, the other structure which pierces the buccinator muscle is buccal branch of mandibular nerve. Okay, buccal branch of mandibular nerve, we have already seen it, the buccal branch from the mandibular nerve of trigeminal nerve. So this is the buccinator muscle, and it is related to the two arteries. One artery, the facial artery, and this is the facial vein or interior facial vein. Okay, so the artery is related interiorly to the buccinator muscle, while the facial vein is related posteriorly to the buccinator muscle. And this facial vein or interior facial veins combine with the interior division of the retromandibular vein to form the common facial vein, and this is continuation of the angular vein. Okay, so this is about the vessel which is related to the buccinator muscle. Now the two nerves is related to the buccinator muscle. This nerve is marginal mandibular branch, and this is the buccal branches. Okay, buccal branches of the facial nerve, and this is marginal mandibular nerve. Okay, so the buccal branch of mandibular nerve, it is from the trigeminal nerve, while the buccal branch of facial nerve, it is branch from the facial nerve. Okay, it is also, the buccinator muscle is also related to the parotid lymph nodes. Okay, so it is pierces by two structure. One is the parotid duct and the other is buccal branch of mandibular nerve. While it is related to the two vessels, one is facial artery to the interior and the interior facial vein to the posterior, while the two nerves are buccal branch of facial nerve and buccal branch of mandibular nerve. Now this, you can see, this is the parotid gland and this is the parotid duct. Okay, and this structure which is in the inside or behind the parotid duct, this is the facial nerve. So after exit from the stylomastoid foramen, this is the facial foramen. Now you can see it separately. So this is parotid gland and the facial nerve pass through it. Okay, so this is the facial nerve proper. After exiting from the stylomastoid foramen, it gives two branches. One is posterior auricular nerve, this is posterior auricular nerve, and this one is the facial nerve branches to the posterior belly of digastric muscle. Okay, and stylohyoid muscle. Okay, now when it enter into the parotid gland, it get divided into two division. One, this one which is superior, this is temporofacial division, and this lower one is cervicofacial division, and together it gives five branches. Okay, the first one is this temporal branch, zygomatic branch, okay, buccal branch. Okay, this is the buccal branch of the facial nerve, and this one is marginal mandibular branch, and this is cervical branch. Okay, cervical branch. So all of these branches give motor innervation to the facial muscle or muscle of facial expression. The cervical branch gives supply to the platysma muscle. Okay, so this is about the motor innervation of the facial nerve to the muscle of facial expression. Now towards the arterial supply. So the arterial supply of the face is mainly from the external carotid artery. Okay, it is mainly from the external carotid artery, and the branches which arises from the external carotid artery to give branches to the face or facial artery. Okay, facial artery. Then the second branch is superficial temporal artery, which is one of the terminal branch of the external carotid artery, and the third one is maxillary artery. Okay, maxillary artery, it is the other terminal branch of the external carotid artery. So these are the branches which give supplies to the face, and it arises from the external carotid artery, and some of the contribution of is from the internal carotid artery, and it is the branch which gives contribution to the arterial supply of the face. That is ophthalmic artery. Okay, ophthalmic artery. So in this diagram you can see this one, this artery is facial artery. Okay, this is facial artery. Okay, and it give branches like inferior labial artery, superior labial artery. Okay, so this is from the facial artery, and facial artery runs interior to the buccinator muscle, and this artery which is from the superficial temporal artery which supply the face is this transverse facial artery. Okay, transverse facial artery. Now the it also gives the arterial supply is also from the this artery, which is maxillary artery, and it gives a lot of branches like inferior alveolar artery. Okay, this is inferior alveolar artery. The temporal artery, interior deep temporal and posterior deep temporal, middle meningeal artery. Okay, this is mesenteric artery. And the buccal artery. So all of these artery are from the maxillary artery, which also supplies the face. Okay, it also supplies the face. So this is the about the maxillary artery. Now there is also branches from superficial temporal artery, which is this transverse facial artery, the main branch. So this is about the arterial supply. Now the branches from the ophthalmic artery, which is branch from the internal carotid artery. It is this supraorbital artery. Okay, this is supraorbital artery, and this is supratrochlear artery. Okay, so this is the branches from the external and internal carotid artery. Now the venous supply. Now we will discuss about the venous supplies, that how the venous veins drain, venous drainage. So you can see this is supraorbital and supratrochlear vein. It combines to form this vein, angular vein, and then angular vein passes downward and it continue as the interior facial vein. So this is interior facial vein. You can see this is interior facial vein. Now this vein, which is superficial temporal vein, it combines the maxillary vein. Okay, maxillary veins combine with it with superficial temporal vein. So this is superficial temporal vein and it joins with the maxillary vein. Okay, these are maxillary veins to form the retromandibular vein. Okay, retromandibular vein is behind, it pierces the parotid gland. Okay, and after exiting from the parotid gland, it divided into interior division and posterior division. The interior division goes downward and it combines with the interior facial vein to form the common facial vein. Okay, so this is common facial vein, and the common facial vein drain into the internal jugular vein, while this posterior division of the retromandibular vein combine with the posterior auricular vein to form the external jugular vein, and this external jugular vein then drains into the subclavian vein. Okay, so this is the cut end of the external jugular vein. Okay, so this is external jugular vein draining into the subclavian vein. Okay, so this is about the venous drainage, and the veins of the face is directly or indirectly connected to the cavernous sinus. Okay, so the cavernous sinus, this is the direct connection of the facial vein or the face to the cavernous sinus is through the supraorbital vein and the supratrochlear vein. It supratrochlear and form the this is the branch from these artery veins, superior ophthalmic vein. So superior ophthalmic vein directly connects with this with the it is not shown here, but it directly connects with the cavernous sinus, while the indirect connection of the interior facial vein with the cavernous sinus is through this plexus, which is pterygoid plexus. Okay, this plexus of the vein is pterygoid plexus, pterygoid venous plexus. Okay, this is the pterygoid venous plexus, and the deep facial vein connects with the pterygoid plexus, and then from the pterygoid plexus imaginary veins connects the pterygoid plexus with the cavernous sinus. Okay, so this is about the venous drainage. Now the nerve supply, we have already discussed that the first is motor supply, which is from the facial nerve. Okay, which is from the facial nerve. This is facial nerve, and it supplies the muscle of facial expression, while the cutaneous innervation is by the trigeminal nerve. Okay, and it's three division, except the angle of the jaw, which is innervated by the greater auricular nerve, which is the ventral rami of the C2 and C3 cervical spine. Okay, so this is all about the anatomy of the face thing.